for the health and safety of the American public. It shows the role of government can be important. It shows that we do know how to do this to protect our families. Mr. President, I urge the FDA to step in here on this issue and help American families. Mr. President, I yield the floor. Jesse Absolucor. Oh, I'm sorry. I take it. Yeah.
Mr. President.
The senator from Iowa.
Mr. President, I watched many of the statements made by so many of our women senators who came to the floor in the past hour to talk about this issue of women's preventative health services. I was unable to get to the floor at the time, but I want to be here now because, Mr. President, there unfortunately is a lot of confusion going on about what the Affordable Care Act does and does not do with respect to women's preventative health services. As chairman of the Health, Education, Labor, and Pensions Committee, and as someone who was very much involved in crafting this legislation, especially the preventative services part of that legislation, I hope to explain the facts and debunk the myths and the misinformation that have recently arisen on this issue. First, women, nurses, teachers, professors, homemakers, attorneys, everyone from all walks of life, all women in America, now have the right to preventative health care services. Beginning this August, the Affordable Care Act guarantees that insured women will have access to expert-recommended preventative health care services. These basic services include well women visits, mammograms, prenatal care, cervical cancer screenings, and contraception. These critical services will be offered without any out-of-pocket costs such as co-pays or deductibles. It's the latter, the ability of women to have a health insurance plan that covers contraceptives, that has led to this recent controversy and this outpouring, this outburst of political accusations. Here, let me emphasize, people of strong faith and good conscience have very different views when it comes to these matters. I understand that. I have great admiration for the many contributions that religious institutions make to our country. Catholic charities provide vital assistance to low-income Americans. Religious universities teach and prepare thousands of young people to be outstanding citizens and productive members of our society. In fact, I attended law school at Catholic University, right up the street here. I also attended Catholic elementary schools and Catholic high school. And Catholic hospitals are instrumental in providing first-class health care to so many of our fellow citizens. I have spoken many times about the care that Mercy Hospital in Des Moines, a Catholic hospital, gave to my father when he was elderly and in bad health because of black lung disease, and he had no money. And they provided care for him at no cost. So I have very deep feelings about the generosity and the care that these religious hospitals provide. It is for this reason I would oppose any measure that threatens the fundamental religious liberties of these institutions. I believe, however, that the President properly balanced the essential health care needs of women with the rights of religious institutions. Let me clarify what this rule does and, most importantly, does not do, since folks like Governor Romney are misleading the American people, perhaps intentionally distorting the facts, using the issue for demagoguery. First, churches and other houses of worship are specifically exempt from the requirement that they carry insurance plans that provide contraception. Second, no individual health care provider, neither religious nor secular, will be forced to prescribe contraception. The President and his administration have previously and continue to express strong support for existing conscience protections. Moreover, other religiously affiliated organizations that employ people of different faiths, like Catholic colleges and hospitals, can qualify for a one-year transition period as they prepare to comply with the new law. Let me point out, no individual will be forced to buy or use contraception. No individual will be forced to buy or use contraception. Under this policy, women who want contraception will have access to it through their insurance without having to pay a co-pay or deductible. But no one will be forced to buy or to use contraception. Let's make that clear. Drugs that cause abortion, like RU-486, the morning after pill, are not covered by this policy. Again, let me repeat that. Drugs that cause abortion, like RU-486, the morning after pill, are not covered by this policy. And nothing about this policy changes the President's firm commitment to maintaining strict limitations on federal funding for abortions. No federal tax dollars are used for elective abortions. Now, again, let me quote what Governor Romney said. Quote, here's what Governor Romney said in Colorado just yesterday. Quote, just this last week, this same administration said that in churches and the institutions they run, such as schools and, let's say, adoption agencies, hospitals, that they have to provide for their employees, free of charge, contraceptives, morning after pills, in other words, abortive pills and the like at no cost, Mr. Romney said. Think what that does to people in faith without sharing those views. This is a violation of conscience, end quote. Well, Mr. Romney, this does not cover morning after pills. And the adoption agencies and the hospitals do not have to provide free of charge contraceptives. All they have to do is to make available through the broad insurance coverage they have to women who choose to use contraceptive services. They can get those without any co-pays or deductibles. But this does not cover the morning after pill. And yet I keep hearing, I heard it this morning, I was working out this morning and watching CNN, and somebody else came on there talking about the Catholic Church is opposed to abortions. They shouldn't be funding, they should be forced to fund abortions. This has nothing to do with that. All it says is that if you have a broad-based insurance policy and you're not a religious institution or a church, and you are, let's say, a hospital, and you have insurance that covers a broad array of people, we've said that that insurance must cover a broad variety of preventive services, mammograms, cervical cancer screening, well women visits, all of that, and contraception. And contraception, a preventative service. So Mr. Romney is going around saying these things, but it's not true. It's simply not true. He's either misinformed or he is purposely trying to mislead the American people, neither of which is acceptable. As I said, churches and other houses of worship are specifically exempt from the requirement that they carry insurance plans that provide contraception. Secondly, no individual health care provider, neither religious nor secular, will be forced to prescribe contraception. No individual will be forced to buy or use contraception against her own conscience. All the rules the President announced ensure that all women, no matter who their employer, has the opportunity to enjoy the same insurance and same vital preventative services. Every woman. In fact, there's nothing radical about such a policy. 50% of Americans currently live in 28 states that require insurance companies to cover contraception. Imagine that. Imagine that. Several of these states, like Arizona, New York, Oregon, California, have had this law in effect for years, saying that if you have insurance coverage, you have to provide contraceptive services under that broad coverage of insurance. And these states have identical religious employer exemptions as the rule the President announced. Let me repeat, 28 states, including states like Arizona, New York, Oregon, California, have identical religious employer exemptions as the same as the rule that the President announced. Now, I didn't hear Mr. Romney going after the governors of Arizona or of New York or Oregon or California. So this has now become a political issue, and it shouldn't be. It shouldn't be. Religious institutions continue to serve the public by providing exemplary health, education, and anti-poverty services in these states. And I'm hopeful that nothing will change in the rest of the country. 28 states, half the people already live in those states that cover the same thing. Mr. President, the health of women in this nation is far too important to become a soundbite on the evening news, a headline in the morning paper, or political rhetoric, again, to divide us up, to divide us up. The President's policy and what we've done does not divide us. In fact, if anything, it unifies the country. I don't think anyone thinks that we should pass a law banning contraceptives. No, we did in the old days, you know. There was a Supreme Court case about that. As a matter of fact, I read in law school when I was at Catholic University Law School. Griswold v. Connecticut, if I'm not mistaken. Supreme Court said no. You can't. The state has no interest, no vital interest in telling women that they cannot use contraceptive services and devices. And that's an old case. Now, again, if someone is conscience-bound and they don't want to, they say they don't, that's fine. No one is being forced to do anything against their conscience. No one's being forced to do anything that we haven't already done in this country in 28 states. But now it's become political rhetoric. How else to explain Mr. Romney's total misinformation? To try to divide us up as a country again. Time to put this aside. Time to put aside these differences, these divisions, and focus on giving people access to the affordable health care they deserve. That's what the Affordable Care Act does. And we shouldn't let political rhetoric, political gamesmanship, a political campaign, again, try to tear us apart. Try to misinform people, to inflame passions, that somehow we have gone off on a different path, that we're doing something totally different than what we've done before. We're not. We're not. We're not. And to include in this the inflammatory rhetoric of abortion and all that that entails is doing a disservice to the women of this country. So I hope that the truth will out, that this misinformation will fall by the wayside. People will see this for the political rhetoric it is, and that we'll move forward with a health care system that does provide broad preventative services to every woman in America. That's what this is about. Mr. President, I yield the floor. Oh, and I note the absence of a quorum.
The clerk will call the roll.
Mr. Akaka. Alexander. Majority Leader is recognized.
I ask consent to call quorum be terminated.
Without objection.
I now move to proceed to calendar number 311.
The clerk will report the motion.
Motion to proceed to calendar number 311, S. 1813, a bill to reauthorize the federal aid highway and highway safety construction programs and for other purposes.